Good morning. My name is Lori. I'll be your nurse today. Can you tell me your name and birth date? Great. It says Winter Snow on here, and that matches your armband. I'm going to just wash my hands here, Winter. The doctor wants us to get a urine sample from your catheter, so what I need to do is I need to actually clamp your catheter for 30 minutes, and then I'll come back and actually get the sample. Okay, so there's a couple of different ways that we can clamp the catheter. Again, I just want you to take a look at her urine here. Her urine is kind of a dark, little bit amber color, and so the doctor wanted us to just make sure she doesn't have a urinary tract infection. We would never use the urine that's in the tubing, so we would make sure that all of the urine is in the bag. We want to make sure that we clamp the tubing, and again, we're going to just use a rubber band, and I will show you one other way that you can, and again, just make sure it's tight enough, but one other way that you can clamp it using a clamp. Finger in here. Good. Okay, and we're going to clamp that for 30 minutes, and we're going to come back in 30 minutes. But the other one, we're going to just show you how to use a different type of clamp. If this was in the patient, again, we would put the clamp over the top of the tubing. Let's just come down a little bit here. And then what I'm going to do is I'm going to just turn this, and you can see there's a little area in here that's just going to compress the tubing. Sometimes these get a little hard to turn. If you have gloves on, sometimes it's a little easier to turn, but you can see that's compressing the tubing nicely. Okay, good. And so that's just a different way you can compress the tubing. So we're done for now. We're going to let Winter know that we're going to be back in a half an hour to get her sample. Thanks, Winter. We'll see you later. Hi, Winter. I'm back. I'm just going to go back to your name here. Can you tell me your name and birth date? Great. I know that gets kind of old for us to ask that, but we have to get your name and birthday just to make sure it matches all the paperwork that's going to go with your urine sample. Okay, so the first thing I'm going to do is wash my hands. And oh, we've got some urine in there, so that is good. I have all my supplies on the table here. I have my urine specimen cup, which is here. I have my biohazardous bag, which I need to put my urine specimen in. I have my gloves. I have my syringe, and that's all I really should need for this sample. And alcohol. I have alcohol in my pocket. I should probably take those out and put them on the table. Okay, so my urine specimen cup, I'm going to put right here on the table, and I'm going to always put the cup up so that I don't contaminate the cup. I have my syringe here, I'm going to open up my syringe, and it has just a cover on it, which is fine. I take my alcohol pad, and I'm going to wipe the port, and again, this is a Luer lock port, so I'm going to come and I'm going to wipe this for 15 seconds. Good. I'm going to take my cover off my Luer lock, and again, keeping the tip as aseptic as it can be. I'm going to turn it on here, and I'm going to aspirate the urine that's in here out. Good. So I'm going to aspirate as much urine out as I can get. Good. And then I'm going to take that, and I'm going to come over my urine specimen cup, and I'm going to just empty that in there without touching the syringe to any of the sides. Okay, and I'm going to get rid of my syringe. I'm going to put my cover on. Okay, on the side, it actually asks for the patient name, room number, date, time, and the doctor that ordered it. We would also want to make sure that it says that we got the urine specimen from the patient through the catheter, in addition to a sheet that has to go into our biohazard bag. There should be a transmittal slip that goes with the urine sample, which is always a sheet of paper that has the patient's room, name, urine specimen, where it came from, the date, who got the urine specimen, and that's always sent in a different area of the bag so that it's not contaminated. The other thing we would want to make sure that it says on that slip is if they're on antibiotics or not. That would make a big difference. And then we would take that to the lab, or take that to wherever, the lab or the refrigerator in a long-term care facility. The last thing we would want to do, and we would actually unclamp this before we took our sample there, we would unclamp our Foley so that her urine can drain out again. Okay, Winter, your Foley's unclamped now, so you shouldn't feel any more pressure. You let us know if you need anything else, okay? Now the last thing I want to do is just show you a different, the sample we got from this catheter actually was a lure lock. There's another type of tubing that somebody might have on their Foley catheter that kind of looks like a bullseye. That kind of a bullseye, you need a blunt tip catheter on the end of your syringe, and I'm going to show you that now. I would take my syringe out. Again, I would use a blunt plastic tip cannula, and I would keep the tip as aseptic as possible. And I would use my alcohol wipe. And again, I would wipe this for 15 seconds. Good. And I take my cover off. And I'm going to actually put this in at 90 degrees. So I'm going to put this in. You can see it went through. And again, this Foley obviously doesn't have any urine in it, but I would aspirate the urine into here as much as I could get. And again, I would have my container open. I would come over and I would squirt it into my container just like I did before. And the last thing I want you to see is that you then would need to unclamp your catheter to make sure that the urine can run through the tubing. Okay? All right, that is how you get a urine specimen from a Foley catheter.